Okay, we're here today with Dr. Leonard Valentine, and Dr. Leonard Valentine, with people that are injured in these auto accidents, many times they're confused if they were actually injured. How would you go about determining if they were injured?
Yes, first thing I would do would be have them come in and fill out some paperwork. The paperwork is designed to get some clues and ideas, what type of injury it was, how the accident exactly happened, and then I'll get further information through a consultation. The consultation is time I can be one-on-one with the patient and ask them, positioning of their head, of their body, exactly how the accident happened. That will give me information. Certain types of positioning is very damaging to the joints and to the surrounding structure. So in the consultation, I will find that out.
Such as?
Example would be a side impact. That type of accident seems to do more damage historically.
Because
the joints aren't really designed to take that lateral movement. There is really no joint to that. So the lateral movement is from side to side, as you may well know. Mm-hmm. So and then I find a great deal through my 29 years experience in palpating people for muscles that are contracted and guarded, for tender and hot spots along the spinous processes, and certain segments give you the indication of a injury, whiplash being sustained.
Now, some people, of course, they're in an accident and they feel immediate pain or discomfort. They might go on to the hospital, like emergency room, or they might go on to their medical doctor, and they're told or prescribed muscle relaxers and painkillers, and they're told maybe it might go away in a couple days, but there is no further guidance. What would you have to say about those individuals that are in that type of...
Yeah, through my experience over the years, what I find with so many of those people, not right away oftentimes, but several years after, when I get a really thorough history, I do find out they had been in an accident, and now they're suffering the repercussions of this accident from several years ago. So I say a qualified doctor of chiropractic that sees probably in the way of historically about 50-60% of auto injuries, because they are specialists in that area, would be able to best tell you if you've been injured or not. Another thing I hear quite often is, geez, I didn't want to come in right away because I was too sore. Well, in our office, and many of the doctors that we associate with, we would take that in consideration and work with you accordingly. But after you've sought other doctors or help and want to get to the cause of the problem so that you don't have chronic issues from this injury later on, best to come in to see us as soon as possible.
And that is real important from the standpoint insurance companies. Isn't it true that insurance companies want individuals to be seen right away versus seen maybe a couple weeks later?
Yeah, it's oftentimes what we find is an insurance company will want to deny coverage because they say, well, it's been 30 days, so it's not the result of the accident, which our experience is, hey, sometimes with endorphins and the body being in a state that it's guarding, that you may not feel anything. The only way you really know is to come in and get that exam.
Now, some people have different cars, and cars are designed today to have crumple zones. And there's individuals that might be in trucks that have open beds, and those individuals now that have trailer hitches and might be hit from the rear. Can you explain the difference of how that is, and even with minimal damage as far as cost of repairs, how those individuals might be affected?
Yes, there's only several cars that do sustain the force of the impact, which it has a like crush zone where the car will absorb the impact, and then the person doesn't sustain as bad of a trauma or injury because the forces aren't directed into the driver or the passengers. But a lot of cars, especially with the trailer hitch, that's what we see some of the worst injuries. That thing picks up and there shows no damage. And all that force is going to be directed then into the driver and the passengers. So trailer hitches are a lot of cars. I mean, they by even safety standards and the legal aspects of building a car, you have to be able to take a 15, 20 mile an hour impact without even seeing damage on the car. So don't think just because you think there's no damage on the car that you weren't injured. Again, it's best to get us to check you and find out if you have been injured or not.
So if someone has had injury and they're seeking treatment, and do they seek a massage therapist? Do they seek a physical therapist? Do they seek a pain management doctor? Do they seek a doctor of chiropractic? What is the difference with those individuals and the type of treatment that they're going to receive?
Yes, that's a great question. I think that most of those doctors would be effective, and they'd give some degree of relief. But through our experience over the years, I'm biased because I feel that if you don't break up those adhesions and scar tissue that happens anytime you have an injury, and you let that tissue go ahead and be lack of the word is really, you don't want that tissue not to be mobilized, and you don't want it not to be manipulated. You want at some point or early on, but after a lot of the pains reside, you want to get good motion and function back in there, so the body absorbs this unhealthy scar tissue and lays down a better tissue that won't accelerate the decay and the degeneration that will happen if you go to massage therapists, a physical therapist, anybody that's dealing more with the muscles. We're dealing actually with joints that have been traumatized and injured, because what happens in an auto accident, there's these check ligaments that are to hold everything in place, but in a force that happens in a nanosecond that you don't even realize happens, it takes it beyond those limits, and that's where you get the bleeding and the scarring and this bad tissue that can create chronic problems.
So many times I refer to soft tissue, whiplash, soft tissue. Soft tissue, insurance companies look at that being like a no big deal. What has been your experience with this, and what other structures are involved?
Yeah, we deal with professionals and specialists, and we've read the books and seen the literature and the research. Soft tissue is for real. It doesn't show up like a broken bone, but there is studies now that are available that we can show exactly how the injury has affected the area and how that person will have ongoing chronic and trouble from it. So no, it's as serious or more serious than a broken bone, because a broken bone will heal as it was originally, where in a joint injury, a sprain strain is going to have this scar tissue, and if we can't get the body to reabsorb it, that's going to be an ongoing and chronic situation and issue. I have a model I oftentimes will use where it shows that there will be hypermobility around the area that's been traumatized, and which will cause chronic inflammation, an extra amount of nerve tissue, just creating a chronic pain situation.
Now, I know that you specialize in treating of these individuals and auto injuries, and you've had great success, and I know that you've also had those individuals that thought about consulting an attorney before they come into your office, or getting a referral from a friend to an attorney. What is your opinion on that? When should that patient come into you? Should they come in before? Should they wait to get the attorney?
We have in our network a large number of different specialists and attorneys that we can go ahead and help you with and guide you and direct you to get the best for your situation, so that you'll be pleased at the end with the outcome. You'll be pleased on how things go along. Because the biggest complaint I hear is when somebody goes to a friend's attorney, is that there's no communication, and we would just not deal with somebody like that isn't keeping you informed and communicating with you and making sure your car's handled, everything's handled, and all you have to worry about doing is getting well.
Now, I know that some people, they call you and they might be out of the general area. What happens if you can't treat these individuals because of distance, of time, of their work schedule? Is there other doctors, that you can refer them to that that are qualified?
Yes, besides the network of attorneys and orthopedics and neurologists and other specialists, we do have a network of chiropractors that we feel can treat people the way we'd expect to be treated ourselves. And so we would direct you to one of those.
Mm-hmm. Now, a lot of the complicating factors people end up with disc damage as a result of these auto accidents, and I know that they might not necessarily show up right away, but they might take a month or even 2 months to show up. What type of procedures could be done for those people that desire to get the relief but avoid, back surgeries or neck surgeries?
Yes, sometimes during the initial phase or soon after, we'll schedule an MRI. We have facilities that do special MRIs, so we can really look at the disc and the soft tissue. And if we do find in the report, that there is a disc involvement, we in this office and the ones that we would refer you to, we'd want to make sure that they have a certain type of procedure. Not just a non-surgical approach, but it is non-surgical decompression is a general term, but there's other things that we would want to accompany that to make sure that you get a better outcome of the disc injury that has resulted due to the car accident.
Now there are different forms of MRIs, and I know that with these people that have these neck injuries or damage, let's say they have some underlying arthritis or degeneration. Is there any other specific type of MRI that can pick up these subtle differences rather than traditional MRI? Have you heard of any of these?
Correct, that's right. Yes, that's the type that we prefer to use because there's a lot more evidence, and evidence is what you want when there's an injury that's sustained to get, to help in the resolution of the settlement. So there are MRI centers, just a few, but there are some that specialize in doing motion studies or whiplash studies to find what has happened to the joints and the damage that has been done, which helps in the settlement of the case and helps with the best of the outcomes.
So if someone was to contact you after watching this video because they saw you on the internet, how would they get a hold of you?
Yes, I hope our number will be posted in front or on the screen. If it's not, I would tell you our phone number here is 714-964-9566. Again, it's 714-964-9566. I mean, there's no obligation. The consultation would be free. We would tell you if you have a case or not. We will direct you. We will help you through this whole process. And most of all, be concerned about you getting the best outcome possible.
Thank you.